Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Today on Lyme Time, it is my honor to welcome back Dr. Kelley. In case you missed it, she and I recorded a great episode of Lyme Time on integrative medicine and what that means. So please look that up. But today we're going to be talking about SOT therapy and everything you ever wanted to know about SOT therapy. Dr. Casey is on clinical faculty at Northwestern's Feinberg School of Medicine. Board certified in family medicine, Dr. Kelley was among the first physicians to become board certified in integrative medicine. She has studied the causes, effects, and treatments of disease extensively and lectures nationally on this and other topics. Dr. Kelley graduated from the Ohio State University College of Medicine and completed her residency in family medicine at St. Joseph Hospital in Chicago. She's a 15-year member of the Institute of Functional Medicine, a past board member of the International Lyme and Associated Disease Society, ILADS, and she is a past presenter at the Tick Chicks Losing Lyme Retreat, and she's also scheduled to speak at the 2025 Losing Lyme Retreat in October with myself. Prior to founding Case Integrative Health, Dr. Kelley practiced medicine at Whole Health Chicago, Michigan Avenue Immediate Care, and St. Joseph Hospital. Welcome again, Dr. Kelley.
Thank you so much for having me back.
I know it's a thrill to see you again. You're just one of my favorite people to talk to because, you just really get to the point. You understand what people are going through. You have healed from Lyme disease yourself. And it just I find anybody associated with ILADS speaks the language of Lyme, and they know exactly what their patients are talking about, and they can really tune in quite easily. And I know that at your center, you offer SOT treatment. And that's what I wanted to focus on today because I get so many questions about SOT. And, it is a little bit pricey. It's a lot pricey, let's be honest. So, and there's a process that you have to go through. And I think people get confused and they get a little scared and they kind of pump the brakes a little bit and want to know, hey, is this for me? And will it actually work for me? So let's start from the very beginning. Let's just start with the question, what is SOT?
That's a wonderful place to start. So SOT is supportive oligonucleotide therapy. And so oligonucleotides or nucleotides are portions of our genetic material of different things. And I think one of the easiest ways for me to describe it is how it is used for infections. But this technology is used for multiple things. There's a lot of cancer usage for this, but it actually has been FDA approved for something from 10 to 17 different medications for different things. And it was first approved in 1998, actually for CMV retinitis. So there are certain diseases out there that have FDA approval to use this technology on things. And we can go back to FDA approval in the future about Lyme, but and for co-infections, but the way that it works, and this is exactly how I describe it to my patients. We draw your blood, and once we know there's a positive infection in your blood, we send your blood to Greece, to the lab, and they will look for your infection in the blood, and then they will look at the genetic code of that, and they will find the off switch. The replication switch. They'll find the genetic material that says grow and replicate. And what they will do is create the off switch. So they're using mRNA technology, but it's what it does is it kind of couples to the genetic material of the infection, that particular, very, very specific, unique code, and connect to it to turn it off. So that bacteria or virus or parasite can no longer grow and replicate. So it cuts it off. so it kills it. So
Okay.
it's a very different way of attacking an infection, very, very targeted approach to
So
it.
it's so, so specific. So I want everybody out there to understand that right now, SOT therapy or SOT therapy is used for certain types of cancers, and certain types of viruses and certain types of Lyme. So obviously, our listeners will be listening, specifically to the Lyme and co-infections. So in my notes here, I have that it targets Borrelia, Bartonella, Babesia, and a couple of other tick-borne bacterial diseases, Anaplasma, Rickettsia, and Ehrlichia. Is that about right?
Yeah, Ehrlichia.
Ehrlich-
Yeah.
And so, your doctor, when they draw the blood initially, will be specifically looking to make sure that you have one of these, if not more. And if you do have more, that's tough because you have to really target one at a time. So each treatment is only allowed to treat one at a time. That's all that they're looking for. And would you say that the majority of your patients fall into one category, or do you see them across the board?
So most of my patients have more than one infection. Yeah, and that is a downside to this versus, say, ozone or herbs or something that can target multiple things at once. This can really do one very specific critter at a time. And there are multiple Borrelia species, BART, Babesia, Anaplasma ehrlichia, and then viruses too. There's a load of viruses that it can be used for as well. But you can only do one. And each time you do one, you got to pay for the treatment. So it can really add up if you have multiple infections to treat. Yeah.
And is it right to assume that it may take a couple of times, a couple of treatments? Let's say if you're specific to Borrelia, would because for instance, my own doctor suggested I do two separate things for Borrelia and two separate SOT treatments for EBV.
Mhm.
And
Yeah.
and so that does become for sure more expensive, but I'm
Well,
wondering, since it's targeting the DNA, so in other words, if you're taking herbs for it, does herb versus the herbs, let's say, will the herb eradicate it, or will the herb work as long as you're taking the herb, as opposed to SOT, which is genetically modifying basically, that condition?
yeah, they're different, so they're just different tools in the toolbox, and none of them are necessarily meant to be standalone treatments. So I'm using this as a part of, a whole protocol, and I think that's where you get the most success with SOT or anything for that matter. When you're also juggling the other infections, supporting detox, supporting the immune system, all of that is a really important part. You can't just do SOT and be done with it. The studies that they've done, it showed 1 to 2 treatments for Lyme, and then more treatments were needed for viruses, more like 2 to 3. In my clinical experience, I've only had to repeat a specific Lyme strain in a couple patients. Usually, what I'm doing though is I'm treating, let's say, a Lyme, and then after that, we'll do a Bartonella, and then after that, we'll do a Babesia. So we're doing multiple SOTs, but we're treating multiple different kinds of bacteria parasites. But it's not unheard of to have to repeat it. And we're using symptoms and symptom questionnaires and labs to really help drive that and determine if we need to repeat it or not, to get there. But one and done possibly, but often there's other layers and other things that you need to do.
Yeah, I mean, I certainly fall under that category. I think I have several of these things going on in my body at the same time. I don't, and obviously your own doctor can tell you whether or not it's activated or not activated. And you can also trust your instinct. When I went in to explore SOT with my own integrative medicine doctor, I was feeling I knew I had something going on, and I didn't know if it was more Lyme related or more EBV. I didn't know if I was going through a reactivated stage of Lyme. Well, he did my blood work, and I was I guess you could say thrilled, but I was happy to know that it was just EBV again. And I did have sort of a predisposition to having it recur over and over again. I think I've had EBV just several times in the last, within a handful of years. So that's why I chose to go for the EBV first and foremost, because I didn't feel that the Lyme was reactivating. Okay, let's talk about some of the viruses that can be treated with SOT. I'll just kind of go down the list. Human simplex viruses, human herpes virus, cytomegalovirus, that's CMV, Coxsackie, type A and B, and then shingles, Epstein-Barr, HPV, two types of HPV, HBV, which is a hepatitis, HCV, which is hepatitis, HIV, which is AIDS, and HTLV1. So those are the viruses that qualify for this type of treatment. And I guess I'm in between treatment number 1 and treatment number 2 for this EBV that I have. So it's funny because people will say, "Hey, is it working?" And I'm like, "Well, I think it is. I feel good. I feel strong, and I certainly feel better than I felt before. However, I don't know that I've encountered anybody with the EBV virus. So I don't know if it's that kind of thing where I would expect to have a little bit more resistant to maybe contracting it again so easily. What do you have to say about that
Well,
theory?"
that's hard. It's hard to kind of judge because a lot of times it's just your own internal Epstein-Barr flare, not necessarily that you're contracting it again. It's just that it's kind of flaring back up because you don't really get rid of it. It's kind of like chicken pox. So the
Uh-huh.
idea is just to kind of like calm it down, possibly clear it out. Like that would be wonderful, but these viruses are persistent. They really, really are. So ideally, what would happen if we can get it under control and down to levels where it's very, very manageable, then you would be more resilient. If you come in contact with it again, it might just kind of help remind your system to make antibodies, not necessarily flare it up again out there. So that would be a big part of it. And just stress in general and other things can flare up Epstein-Barr. It doesn't have to be somebody else walking around with a virus. It could just be a really stressful day or a divorce or a move or a surgery or something else that
Yeah.
I kind of describe it like immune system whack-a-mole. When your body's trying to deal with one thing, then the Epstein virus jumps up, says oh, no one's paying attention. So it will jump up and flare up. So,
That's
but
a
it
good
should make you more
point. That's a very
resilient.
good
Yeah.
point.
So that
Yeah.
you're not getting all
Mine,
those.
mine came up after extensive dental work. And I think I was in the chair for 10 hours over the course of
Ugh.
2 or 3 days. And so I really knew going in, I was like, okay, I'm just going to relax. I mean, I did all the things and I really tried my brain retraining and all that. But sure enough, I not only had that, but I had a little tiny case of shingles after that too. So that
Goodness. Yeah.
shingles went into EBV. So that's my
Yeah.
story.
Mm-hmm.
Okay. Obviously, let's talk about SOT therapy can be done on children, but they have to be over the age of 5.
Mm-hmm.
And then there's a certain population that disqualifies you from the SOT therapy, which would be pregnancy or breastfeeding, recent blood transfusion, um, recent chemotherapy, radioactive seed therapy, delta T cell therapy, and children under the age of 11 for cancer. So again, this is a very, very specific treatment. And there can be some side effects in Lyme patients. In cancer, they're a little bit different, but for Lyme patients, you may just experience some herxing afterwards. I think I had 2 days of it after it, and because I knew what my body was doing, I just, rested and I did all the right things and it was over very easily. And have you had any patients have anything more than a Herx reaction?
No, and it varies just like everything else. So some people's herxes are bigger than others, obviously. So there's just a lot of monitoring to make sure that we're helping support it. And we talk to patients before and after, and give some tips and tricks and make sure that they know what to do if that happens. The most I've seen it really last would be 2 weeks, would be the
Mm.
longest I've seen a herx. reaction from it. But then the heavens start to part a little bit and things clear up.
Yeah,
Yeah.
yeah. And there are a few things that you cannot do before you have the blood draw. So before we get into that, will you take us through what it looks like for one treatment? Let's say we're treating for one treatment for Bartonella. How does that look? Because it is mandatory you have a blood draw before any of this begins, right?
Yeah, you have to have a positive blood test for the infection that you're looking for within 6 months prior to getting the blood drawn for the SOT. So, and it doesn't matter what lab that comes from. They're pretty open to taking a lot of different things, but you do need to have a positive test.
Right. So a recent blood work showing you have something that can be treated by SOT, that's very specific to that. And then you go into your doctor's office and they do another blood draw. Am I right?
Mm-hmm.
Okay.
Yep.
And that's just a straight up blood draw.
That's the blood draw. So that blood draw is the medicine that is, sorry, not the medicine. That is the blood that's going to go to Greece to have the medicine made for you. So, in our clinic, the money for the entire procedure is due at that time, because once that blood is sent over and it's kind of processed, that is being made for you and your infection. And I can't use it on anybody else. That's how specific it is. Because, Bob's Lyme is not going to respond to Mary's SOT for her Lyme. That is how specific they are able to get with these, and multiple different, pathways that they're looking at and tailoring it to you. So that gets sent to Greece. It takes a good 4 to 6 weeks, kind of depending on customs sometimes, for that medicine to get back to us.
Mhm.
And that medicine's actually shelf stable for 6 months. So we could draw multiple at a time, knowing that we're going to do kind of back-to-back things. So there's less wait time in between. But yeah.
So when it's over in Greece, and funny kind of, I think that is Greece the only sort of lab that's doing this right now? Because
For Lyme, yeah,
oh,
that I'm aware of, yeah.
and is that because they have looser regulations there, or why Greece? I mean,
Yeah. Just that's where the company is, the lab is that kind of really spearheading this technology. They're using it a lot for cancer therapies as well. And it's not the looser regulations. Like the European Union actually has its own set of issues and their own regulations around these kind of treatments, completely separate from ours. And I mentioned earlier, to kind of come back to this, these treatments are not FDA approved, and they never can be, because they are using actually autologous information. So they're using your blood to make a treatment. So unlike the other SOT medications that are made, those are medications that's made. Anybody who has this can take this medicine for that. So there's actually an SOT for familial hypercholesteremia, for example. And that's not made specific to the patient. That's a medicine that they can just, make over and over again in a lab. SOT for infections are made specifically for you. So it actually is not a thing that can ever be FDA approved. And so I just think that's a really interesting tidbit to kind of look at and see. We always have to counsel patients that this is not an FDA approved treatment as part of that, process of going through, is this the right option for you or not? But that's why it's not FDA approved. But there are,
very
100 medicines that using SOT technology that are in the works of getting FDA approval. So they're using this for a lot of different things, which is actually really kind of cool.
That's very cool. So it goes over there to Greece. They work their magic on it on your specific blood and connecting and linking and I'd like to say enhancing or strengthening your own DNA chain to resist this type of infection.
No, it has
And
nothing to do with your DNA.
okay, so explain that to me. I want to
Yeah.
know.
Yeah, it actually it has absolutely nothing to do or will it affect your DNA. So they are using genetic material. It's actually RNA that they're using, but the code that's being created, the medicine that's being created for your Bartonella or your Lyme or what have you, is a very specific code of these oligonucleotides, or these nucleotides that are the building blocks for RNA and DNA. That is made specifically for a very, very unique pattern that's only on your Bartonella. So it's not going to be found on any of your DNA cells. So it's not a pattern that you're going to find on yours. So it's very, very unique to that Bartonella. So it's that mRNA. So it gets, it kind of scares people sometimes when we talking about mRNA and how it can affect, but it will not affect your DNA because that code means nothing to your DNA.
Okay.
So your DNA won't acknowledge it in there. It's only going to link up to the Bartonella.
Okay, so then when it links up to the Bartonella in your own body,
It links to the Bartonella and says, stop replicating. You
okay.
are not allowed to grow anymore. You must die. So
Wow.
that Bartonella no longer has the tools to grow and multiply.
Okay. That's amazing. Okay, so once that is all linked up in grease, they kind of, for lack of better terms, they kind of freeze dry it into like a little bit of a sustainable.
Yeah, it's really fascinating. They add some like things to the end of the RNA so that it's stable and it comes back to us and it's in a vial and you can barely see it almost. It's just this like little tiny bit of in there that we have to reconstitute. So we put some sterile water in there to reconstitute it, and then we give the medicine back to you via IV.
Okay, and then before you give it back to me in my IV, do I have to have any sort of medicine to receive that? Or, yeah.
Yeah, so they do have a couple recommendations before the actual first blood draw as well as the treatment. So the 2 weeks leading up to both of these things, they recommend you stop all antimicrobials that are going to treat that specific infection. So let's say you're on Mepron, but you're going to get the Borrelia SOT. You don't necessarily need to stop Mepron because that's not going to treat the Borrelia. So you just have to stop what's treating that particular SOT. That's hard for some people to go kind of on and off of these things. So sometimes we just use it as a treatment holiday. We just kind of stop it like the whole time before we do the first blood draw and then waiting to get the treatment. Very patient dependent on there. And I have found that the 2 weeks is a little more of a guideline, not an absolute in there. And there's multiple reasons for that. I think they want to make sure there's enough of the circulating infection to find it in the blood work. They also want to make sure that the DNA or the genetic material that the medicine is connecting to is connected to the live bacteria. So we're not wasting that genetic material on dead floating around DNA that may be just kind of shrapnel, if you will, post an infection or an antibiotic, excuse me, or ozone or something like that that's going to kill the infection. So there's some logistics and there's some rules to follow to help get the most bang for your buck because it's expensive. And so we want to make sure we're doing the best we can and you're going to get the best benefit from the treatment itself. So there are this timeline and this time frame and these hoops that you have to jump through before you get the treatment.
Mhm.
The treatment itself, we also usually pre-medicate with famotidine, which is an antihistamine, just to help reduce allergic type of reactions. And we also will give a little bit of a steroid in the IV before we give the medicine, just to help the blood vessels stay nice and tight so that the medicine goes around to more places. Sometimes we'll use Benadryl ahead of times too, especially if someone is a big mast cell um, activation syndrome patient to help kind of manage that flaring and prevent that from becoming a big problem. But the IV treatment itself doesn't take very long. It's a
Oh
push,
no,
so it's not a
it
long
is
at
a
all.
piece of cake for
Yeah.
all the other treatments that are out there and everything we've all suffered through and all the blood draws and everything else. I mean, it basically, I love that you're talking about the behind the scenes stuff that we don't have to know, but I'm obsessed with it and I know my listeners are too. And so we want to know what's going on. But basically, as a patient, you go in there, they draw your blood, you leave. And then you wait a few weeks and the new fresh blood comes back and you go in and they basically, you know, this whole treatment takes about I don't know, 15 minutes,
15
20 minutes,
minutes. Yeah. Yeah,
nothing.
we usually keep people for a little while longer just to make sure there's no big allergic reaction, but
It's
it's
really,
simple.
really, really easy. I want
Yeah.
everybody out there to know this sounds scary, but it's really actually not at all. But I think it's important to say that, yeah, for that the 2 weeks beforehand, you just want to just sort of lay low. I think they even say maybe stop herbals and stop your IVs and high dose vitamin C IVs specifically. There's a list, and you'll get it
Mhm.
if you sign up to do this therapy. Um, and they don't want you to do ozone for 2 weeks before. Maybe lay off some of the supplements that you're doing, any antiparasitic medications, any antivirals, and any antibiotics. So it's kind of yeah, like you said, for a lot of people that might seem a little bit scary, especially if
Mhm.
they're in the acute stage of Lyme disease. So tell me, first of all, what do you think your personal, if you had to guess, what would you say the percentage of your patients, walk away feeling satisfied with the SOT and maybe you redo the blood work and see that something actually changed?
It's pretty high. It's not perfect. Nothing is, but I would say it's about 80-85%. And, when I first started using this, I wasn't using it, and I'm still not using it right off the get-go. When I first started using it, I was using it more for my harder patients. We'd kind of done everything else. We've done antibiotics, we've done herbs, we've done IVs, we've done all these things, and that we're not getting where we want to get. And so those were the people I started to use it on. And those people were finally seeing 25% improvement, 50% improvement. We were seeing changes for the first time in quite a while, which was amazing, right? Especially for those patients. We were all kind of beating our heads against the wall, like, what do we do next, right? And because of that, though, I do use it, I recommend it earlier than I used to. It's still, like I said, it's not the first thing I'm going to recommend. Because I think it's worth trying some of the other easier, more affordable, stuff too. But I am introducing it earlier than I was when I first started because it's expensive, but so is time. And so are all the supplements, and so are all the other things that we do. So if you look at it and really kind of put it all together, and you have this treatment, but that treatment can help you get better faster and it can stave years off of your treatment and the misery, that is absolutely 100% worth it, right? So, unfortunately, it's not a guarantee. Nothing is. So, we can't promise that it's going to clear everything out. But for the right person at the right time, I do think that these are very valuable things to have in our toolbox to offer and to not wait until it's 7 years in, in that. And if you look at it that way, yes, it's expensive, but man, if you get years back sooner, if you don't have to spend thousands of dollars a month on herbs, it actually could end up being a lot less expensive than some of the other treatments.
That's a really, really good point. And I think I think we've all been there to the point in our journey where we're saying, I'm just going to surrender to this and look at it as an investment in your own health. And 85% roughly just in your off the top of your head, that's a pretty good return on your money when you're talking about Lyme disease and how complicated it really is. And a complicated chronic illness takes many different angles, as we all know, but this could be the one. And would you recommend it for any stage of Lyme disease? For myself, I feel like I went through three different stages. I had the acute stage, and then I kind of went through a medium stage where I was better, but nowhere near fully recovered. And then now I'm in more of a preventative stage. Would you recommend it for all three stages, or is there a better place to insert SOT therapy?
I think that's probably a little more patient by patient, kind of where they are and what all's going on and all the different moving pieces parts. Um, I'm like I said, I'm just much more willing to entertain this earlier in the treatment than I used to be. I don't know if I would for an acute tick bite. Although there are providers out there who are using it from the get-go as soon as you get a positive test for those patients to help can prevent things. But um, I'm not there yet, but I definitely am introducing it much earlier. And there are definitely clinics out there too that are using it for anybody and everybody, and that's kind of what they do. And I think it helps so many people. But just like everything else, I really we need to make sure we're detoxing because that Herxheimer happens. And that medicine, once you get the medicine, you get the medicine. It's in there and it lasts for 6 months. So it's going to continue to circulate. So it's not like an antibiotic that you start and you can stop. You can't like this one, once the train has left the station, it's left the station. So the more that you can spend time making sure the patient is detoxing properly and their inflammation is a little better controlled and there's more there, they're gonna respond better to the SOT and have better, longer lasting results from it. And you also have to help repair from the process too. And all of that is a big part of this. And again, it's a tool. This is a tool. This is another tool in our toolbox. And we have to have so many tools because everybody's body is so different and everybody responds so differently to the different treatments. Sometimes an antibiotic, it's all it takes. And 2 days later, the patient's pain that they've had for 6 years is gone, you know? So it is such a fascinating infections right there that will
Really
never
is.
and
Yeah.
never cease to
I'll
amaze
give it
me.
that for sure. It's fascinating. Um, Now, you and I were both at the recent ILADS conference in San Antonio, and there was a panel discussion, or there were three people that discussed SOT treatments and different aspects of the SOT treatments. Was there anything that surprised you that you heard?
Not big surprises necessarily. I thought that it was, a lot of the cases that were presented were patients that had had many, many SOTs. So some of these patients were, they gave the case of them and the study of them over several years. So it's not that they had 12 SOTs in a week. They over the years had multiple, but um, so, because there are all these different layers and all these multiple different infections that people have, that you have to just start chipping away at all the different things. And if it works for you and you get good relief, then going to the next one makes sense, and going to the next one makes sense. And you may be able to stay off antimicrobials then for forever if you can kind of get on top of this in a different way. So if it's a valuable, useful tool, then it is, something for you, then you can keep going. You probably don't want to do more than 10 in a year total, but even that's a lot. I usually wait anywhere from 6 weeks to 3 months to do another round because I really like to have that recovery period. But the range is more like 1 week later to 1 month later seem to be more common. So maybe I'm not doing it as frequently as I should, but I like to make sure that there's healing and repair and recovery before we jump in to the next one. Although for some people, we have done it much sooner because they do so well with it that we can safely move on to the next step. Yeah.
And have you seen in some patients, anything actually disappear? I hear conflicting things about Borrelia in particular. I've heard that Borrelia never quite goes away. It will always read in your labs. Even if you're symptom free for years, it may just be there. And so, I guess what I'm asking is, should we be trying to chase these numbers in our lab work, or should we just go by symptom prevalence after SOT? What's your opinion?
I tend to personally go mostly by symptoms. Um, because I'm not sure that we really have the technology to prove that the infection is fully cleared because it hides out in the tissues and it hides in these round bodies and these cystic forms that are going to evade the immune system. And there's not really a test to look inside of your tissues to see if they're in there. And if they're in there and they're dormant and they're not causing you problems, that's great. But they do have the potential to wake up. Immune system whack-a-mole, right? It's like something kind of can free it up. to get going. So it's hard for me to say cure definitively. Remission is probably a better word. That being said, you could do another SOT 6 years from now if it starts to flare up, and if necessary. That is safe to do. Um, I have seen some really cool stuff. So I do some RNA testing to look for, it's called a FISH test, to look for the actual critter in your blood, virus, parasite, whatever it may be, to try to get a better idea of the activity of the infection. And I have seen them completely normalize and clear out and be completely negative after SOT. So I have really good confidence that these infections are clearing out the infections that I'm seeking to clear out. Are they gone forever and always? Maybe not. But that's part of my job as the clinician too, is once we've got these things at least cleared on our, active blood work or whatever blood work we're doing, then it's our job to make sure that we are doing what we can to keep you as healthy as possible. And have it so you have that intuition, like you have, Allie, where you said something doesn't feel right. I'm not sure if it's Lyme or Epstein-Barr, but something's coming back, so that you can go and get that taken under control again right away when things haven't gotten catastrophic again.
Mm.
That's part of that treating and learning. And it's just the education we all have to do. I mean, we all have to eat well, sleep well, move well. We all need to do that stuff. But us Limeys, we know how important that is, right? And that's the important, like when we start to slip, we don't feel good. You're like, oh my gosh, how am I sleeping? What's my stress look like? And we can kind of get back on top so that it stays in its nice little cystic round form dormant inside our cells and leaving us alone.
Yes. Amen. Amen to that. And just kind of just sort of circling back to post-treatment. Uh, so basically, we're talking about a treatment to help calm down an activation. We are not talking about SOT being a treatment that rids of something forever.
I just don't know if we have the testing to prove that.
Yeah.
So the SOT is going to work for 6 months in your system. And a lot of these infections are very slow growing infections. So with Lyme, you're probably going to get a good 6 life cycles of
Mm.
the bacteria that you're going to hit. Is that every single, are we getting everywhere? I can't promise. But in a sense, it's an antibiotic. It is designed to kill whatever it's in there attacking. It is designed to cut off its oxygen supply, you know, metaphorically, so that it can't grow and replicate anymore. So it dies. So it's an antibiotic in that sense. It's meant to kill the infection. Is it going to get rid of every single last morsel? I don't know. But that's not where I would waste my time and energy and effort, because there's so many other things we can be doing, because your immune system is super duper smart too. And it is smarter than Lyme. Lyme is smart. I'll give it that. But our immune systems are smarter. And so if we can get that infection down to a spot where it's negligible, then your immune system has space to heal and repair, and it can keep it where it's negligible. And then it's an afterthought, you
I
know?
love that. I really do. I mean, as you said, with anything, we try, we take a stab at it, we see where we are after, maybe a couple of treatments of this, and reevaluate and really give our bodies the best chance on any of these treatments. And something, that you talked about was comparing it to an antibiotic. Perhaps this would be something that would be a useful alternative to an antibiotic, possibly because the way I understand it, it wouldn't be doing the gut damage. And also, can you confirm that?
Yeah, yeah. So antibiotics are kind of like cannonballs in that sense, because they're just going to kind of go in and destroy everything. So they destroy the good bacteria in our gut, for example, as well. So yeah, they leave this wave of destruction behind them. So they help fight the infections we're fighting, but they fight everything else too. And then there's extra healing and repair. And for those patients who can't tolerate antibiotics, or antibiotic herbs for that matter, this is a very different way of doing it. And it is, you know, it's different in the fact that you have to do specific bug by specific bug by specific bug. You can't just give cryptolepis and know that it's going to treat multiple infections. but you're not going to get, it's only that it's only going to go for that particular bug. So it's not going to hurt the good bacteria in your gut. It's not going to hurt your DNA. It's not going to hurt the good guys. It's not going to hurt any of the other bad guys too. But, I have noticed this, and some of the other doctors were talking about this at iLads. Let's say you have multiple Borrelia species in your system, and which we pick one. It's usually Lyme, but there may be another Borrelia species that seems to be the loudest for you. And we treat that one, maybe to the top one or two that are going on, and then later the blood work for all the other ones is better too. Now, is there cross coverage? Are they treating that Borrelia? I don't think so. I think what's happening is you're freeing up your immune system to go, oh, okay, well, now I have the space and energy. I can take care of this one and this one and this one. Um, the other thing I will say, C2, I want to make sure to note is I will do a Lyme SOT, for example, and then all of a sudden these Bartonella symptoms will creep up that were hidden before. So, we kill one infection and now another one goes, my turn. Here goes the whack-a-mole, right? So then we know BART is our next one to do because that's the next one that's the loudest via symptoms, assuming we have a positive test for it. But it's not unheard of for me to see that as well, where you treat one thing and then someone will say, well, I've never had these symptoms before. Why am I getting new symptoms? You said, because we are peeling the onion and now we're getting to the other stuff that's just been hiding underneath.
And then
This,
they say to you, this isn't working for me. And you're actually like, did you know there are 19 species of Bartonella? Which there are, by the way, that's a fact. And I'm sorry, of Borrelia. And there are 6 in Bartonella and there are 6 Babesia. And those are the ones that we know about. So, for those of you that may have tried it or fear that, oh, this is maybe not going to work for me. First of all, go into it with a positive attitude and just know that, like she said, you just take one thing at a time. You just take one thing at a time. And that's wonderful. Thank you so much for enlightening us all on SOT. I feel so much wiser now. It's a confusing little treatment, and I think people are so curious about it because it's not a standard, easy thing to explain. And you did it beautifully. Are there any final thoughts that you have for our patients out there who might be considering SOT?
Yeah, I mean, definitely reach out, find a provider near you who does this and talk to them more about what's going on and see if it is an option for you. It may or may not be, everybody is a little different, but if it's something that makes sense to you and calls to you and that sounds really, really intriguing, I think you need to go learn more about it and figure it out because we really are seeing some really cool responses to this treatment. And I have big hopes and for the future of it too. I just think it's a wonderful, very, very specific tool that we have that is really, we are seeing finally move the needle for a lot of people that it wasn't before. So that's a winner in my book.
Thank you so much for your time, Dr. Kelley. I'm thrilled to have you back, and we'll be seeing you soon at the Losing Lyme Retreat. And I appreciate your time. I hope to see you soon.
Yeah, I can't wait to see you again. Thank you so much.
Thank you for listening to this episode of the Lyme Time podcast. If you like what you heard, please subscribe on your favorite platform to be notified of new episodes. Remember, this is not intended to be medical advice. Take your findings to your provider to see if something is right for you. No two bodies heal the same, and your doctor knows you and your labs best. You can find out more about the Tick Chicks at thetickchicks.com, and if you subscribe there, you'll be notified of upcoming events like the in-person Losing Lyme Retreat that I host. I also have shopping pages dedicated to helping your at-home symptom relief, as well as a private support group. Join the Tick Chicks tribe on Instagram, YouTube, Meta, TikTok, Pinterest, and X. You are not alone.